new parents are subjected to all kinds of contradictory advice about infant nutrition. But with a few simple guidelines and some advice from precision nutrition parents, you can be sure that you are getting your infant off to the healthiest start. In life, as in other things, where you start can determine where you finish. Infancy, the first year of life, is a prime time for growth and changes throughout the body. What we eat as infants strongly affects our long-term body weight, health, metabolic programming, immune system, and overall aging. The first 6 months. Breast is best for both mom and baby. Babies can be exclusively breastfed for their first 6 months of life. Breast milk is the optimal nutrient mix for infants. It's full of good stuff like antibodies, antimicrobial factors, enzymes, and anti-inflammatory factors, along with fatty acids, which promote optimal brain development. Breastfeeding keeps the baby developing and growing properly, helps infants fight off disease, such as gastrointestinal and respiratory infections, both now and in the future, and may even ensure that the baby grows up to prefer healthy food. Because breastfeeding stimulates the release of beneficial hormones such as oxytocin and prolactin, it can help the mother lose weight and bond with her baby. Breast milk is delivered in a biodegradable organic package, so mom doesn't need to use as much plastic packaging, since tiny humans easily absorb plastic, contain endocrine disruptors. Do your best. And get help if you need it. Not every mother takes to breastfeeding naturally or quickly. If breastfeeding is difficult, PN Parents Erin Vice Trainer and Krista Scow suggest you seek support from a doula or midwife. In addition, lactation consultants are very helpful. The techniques they teach have helped many women successfully breastfeed, even after a difficult start. Erin also recommends the work of Jack Newman and Dr. Sears, the breastfeeding book and the baby book about everything. And while breastfeeding is best, don't feel guilty if you can't breastfeed exclusively. There are many circumstances that might make breastfeeding difficult. For example, you might not be able to breastfeed if you have a health problem, or are taking particular medications. You are not to blame. Just do your best. Don't feel you've failed if you have to resort to some formula, or exclusively use formula, says PN parent Brian St. Pierre. In fact, most formula-fed children do just fine. Just be sure to talk to your pediatrician about the best formula option. And avoid soy-based infant formulas. Months 6-12. Introducing solid food. Until about 4-6 months old, infants can digest most foods. Infants are ready for solid foods once they have doubled their birth weight, providing they can hold their heads up, sit in a high chair, open their mouths when food is presented, and swallow. This usually occurs around 6 months old. At first, offer solid foods in addition to breast milk, not as a replacement for it. The first solid foods should also be liquid-like. Don't give your baby beef jerky right off the bat. Take your time when introducing new foods. Don't rush. Lean eating coach, mother, and registered nurse Eileen McRae suggests offering one new food every 3-4 days. This gives you time to see how your baby responds. Pay attention. If you notice any type of negative reaction, such as respiratory, skin, or GI issues, wait 1-3 months before trying that food again.